Rintaro. How are we going today?
Good, thank you. How are you?
Fantastic. My name's Alex. I'm an exercise physiologist. I'm just seeing you based on a referral that your sort of GP sent me through. So how can I help you today?
I've been diagnosed with mild osteoarthritis.
Yep.
It's in my hips and knees, and recently I gained a bit of weight.
Yeah, okay.
My doctor's also said that I have impaired fasting glucose.
Oh, I see.
Yeah, so he's just referred me to you.
Yeah, okay. Awesome. Do you know much about what an exercise physiologist does?
No.
Okay, fantastic. So the best way I can kind of, explain that is a doctor will sort of provide relief for certain conditions by giving patients medication. What an exercise physiologist does in order to sort of treat, in this instance, osteoarthritis, we provide movement and sort of exercise to essentially provide that relief.
Okay.
Did that explanation make clear? Sorry. Was that explanation, did that make sense, sir?
Yeah.
Okay, cool, fantastic. So just before we sort of immediately get into everything today, I just want to confirm a few details just to make sure that I'm talking to the right person. So I'll just get you to tell me your full name and your date of birth.
My name is Rintaro Akabi, and I was born on the 22nd of the 11th, 1958.
Awesome, fantastic. Well, that all checks out, fantastic. So just moving on to the actual condition itself, osteoarthritis. What do you know about osteoarthritis?
Not too much, I guess, just hurting my hips and knees is all I really know, and then I just listen to the doctor about, what to do about it, I suppose.
Okay, yeah, gotcha, fantastic. So it's something that happens to a lot of people as they age. It's sort of categorized as a bit of wear and tear within the joints, so in this instance the hips and the knees. One of the things that we can do together is essentially by participating in exercise, it's kind of referred to as motion is lotion, so to speak.
Right.
By engaging in sort of some safe activity levels, we can kind of reduce pain, reduce some of those symptoms, and overall, also sort of tackle those other things that you may be experiencing, so increase sort of weight gain. How long have you had osteoarthritis for? You mentioned it was a recent diagnosis, yes?
Yeah, I've been recently diagnosed. I retired about 2 years ago, and ever since that,
Yeah, gotcha.
I suppose it's been affecting me.
What did you do actually, out of
I was
curiosity?
a mechanical engineer.
Oh, cool. Yeah, gotcha. Yeah, my brother-in-law does a bit of sort of engineering and stuff
awesome.
like that. So it's long hours, So definitely appreciate that. Right. Yeah, awesome, fantastic. So just in regards to any sort of just barriers that you're experiencing in your day-to-day life, how does osteoarthritis sort of just impact you?
Well, it's just a pain, it's been stopping me from really getting out and about.
Yep.
I don't really move around too much.
Okay.
I do enjoy going fishing.
True.
I go about once a month. So
yeah, right. Yeah, gotcha.
But ever since, I've been recently diagnosed, I guess it's just been steadily going a little bit downhill for me.
Right. Has it made it any more difficult sort of to participate in things like fishing?
Not so much fishing. Fishing's been alright, but I have been noticing it. It's impacting me. It's a bit of a struggle to get places. The fishing's been alright so far.
Okay. Yeah. Cool. But just sort
it.
of getting through your day-to-day sort of activities. Yeah. Okay. Cool. Gotcha. And just throughout an average day, I guess, are you experiencing anything? Does anything make the osteoarthritis, that sort of knee and hip pain, flare up or make it worse, or?
Yeah, I guess just walking around, sitting and standing.
Yeah.
Definitely hurts a little bit.
Okay, gotcha. Is there, I mentioned before, engaging in a sort of exercise program or movement sort of program to sort of help sort of treat the osteoarthritis as well as combat a little bit of that extra weight gain.
Yep.
Do you have any concerns about participating in anything like that?
Yeah, I guess I really don't want it to get any worse, and I feel
Yeah.
like because I'm walking, and it kind of hurts that maybe if I do actually exercise, might make it a bit worse.
Of course, yeah, and I absolutely want to take this time just to sort of address your comfort around this entire sort of issue. You know what I mean? I want to be able to really put you at ease here that anything that we do together, it's very much disconnected from, I guess, what is conventionally seen when we talk about exercise. You know, we're not doing hill sprints or anything crazy like that. You know what I mean? It's going to be very safe, and it's been very much sort of proven to kind of very much just provide relief for that sort of pain and those sort of symptoms. As I said sort of before, motion is lotion. We keep the body moving. It's going to prevent sort of any of that extra inflammation or those symptoms that we sort of spoke about before. So is there anything that you do in your day-to-day where you find you sort of feel relief?
I guess when I'm sitting down watching TV or lying down.
Yep. Do you notice any sort of, is there any kind of, I guess, increase in pain or anything following those activities if you sort of stay not moving for too long at all?
Yeah, it can sometimes, but it's usually when I'm moving about.
Yeah, okay, gotcha. Awesome, fantastic. Obviously, living with pain and being in pain, it can be extremely frustrating. It's something that can end up always on the mind and really impacting the day-to-day. Do you take any medication currently or pain relief for that condition?
Yeah, well, for my my glucose levels, the doctor has suggested metformin.
Okay, yep.
I haven't actually commenced on taking that yet.
Yep.
I've also been taking ibuprofen.
Okay.
And that's just because, my knees start to hurt a little bit.
Sure, so just taking that when needed type sort of.
Yeah, exactly.
Cool, fantastic. And just considering the metformin at the moment for the blood glucose levels. Yeah, fantastic. Well, it's really great that we're sort of here because we're definitely going to be able to get on top of that just by being able to participate, or at least sort of help combat it a little bit. Excellent, fantastic. So I know we've spoken a lot about exercise and how it's going to help improve the condition. Is there anything, so if we talk about sort of history and stuff like that, have you ever participated in exercise previously?
I did. I used to play tennis regularly in my 30s and 40s, but I have not been playing in years.
Yeah, did you enjoy it?
Yeah, I did, yeah, it was great.
Good fun.
It was awesome. I also used to cycle to work a few times a week.
Okay, awesome. Yeah, now that you're retired, that's naturally can be a little bit difficult to find almost just a reason to, and obviously combat the pain as well. Yeah, cool. Awesome. So if we could look at it as sort of a trajectory or kind of a direction that we could trend in together, with the stuff that we're doing, is there anything that you personally hope to achieve by working with me on, engaging in exercise, some movement, and your condition?
Yeah, definitely. Well, I think first and foremost, the pain, reducing that was the number one priority.
Yeah.
And also reducing my, chance of getting diabetes. So just health is probably one of the top priorities I have at the moment. I've also been interested in trying yoga. My wife suggested.
Oh yeah, yeah, okay.
Yeah, she suggested that I should be doing it because she also does it. So so I've been interested in getting into that, but I just haven't really, had a reason to, or like motivation.
Of course, yeah, I totally see. How are your motivation levels about this sort of getting into this approach, I suppose?
I think, the more I deal with the pain, the more I'm, frustrated. I'm saying like I need a solution.
Yep.
So it is getting higher. I think I should be taking action.
Yeah. Is it affecting your sleep or anything in your outside of we spoke about day-to-day stuff, but your sleep and your stress levels? Is there anything that sort of is being impacted there?
I sleep fine. I wake up sometimes just because the pain, the joints hurt a little bit. But yeah, I sleep fine.
Okay, awesome. And no alcohol or smoking at the moment?
Let me check. I quit smoking 20 years ago, but I did smoke regularly from my late teens to my mid 40s.
Awesome.
And also
Gotcha.
with regards to the alcohol, I quit. I drink wine with dinner most evenings, like 1 to 2 glasses, and I enjoy the occasional whiskey.
So yeah, I do as well. So I can definitely understand that, right? Fantastic. Well, that's everything I need from this section of what we're going to go through today. Just really let me get to know you, and it's going to inform how we're going to sort of provide treatment. From here, we're going to move on out to the clinic floor, and we're going to do a bit of objective testing.
Awesome.
Cheers.
Thank you.
No worries.